Good day, everyone. I'm Dr. Gomez Chua, and today we will be discussing a little bit about menstrual hygiene and equity and why this is important in our school setting. So, menstrual hygiene basically refers to how women and girls take care of their sanitary needs during the menstrual periods. However, despite many advances in our school systems and institutions, menstruation is still a very much a taboo topic in many countries, including the Philippines. So, this leads to some issues about menstrual hygiene, such as lack of access to sanitary pads or other alternatives. And this sometimes comes with a lack of enough clean facilities for changing and washing during menstruation. So, sometimes even just lacking water is already a big issue for a woman or girl who has to change during her period. In some places, an issue is lack of access to pain relief. This includes medications, as well as places for women and girls to just rest when they are feeling very sick or are in much pain from their period. And this is worse when there is social and cultural stigma about menstruation. Sometimes this comes with a lot of teasing, a lot of misunderstanding, a lot of shame. Shaming girls who have their period for the first time, shaming women for having to be absent when they are feeling sick, and in some places, this also comes with misconceptions about menstruation, and sometimes these can be very harmful to the health of women and girls. So, all in all, these menstrual hygiene issues can lead to absenteeism in a school or workplace when a woman or girl is not feeling well or is not able to change regularly. She may find it better to just stay home from work or school that day. In some cases, when they can still go to school or still report to work, this can still reduce how they can participate in sports and school activities. So, lack of pain relief can make them less able to play in sports that day or can make them more quiet in class. Sometimes they may decide to just stay in one place for the pain to move around since there is no place for them to change, and it is really an issue. So, menstrual hygiene, or lack thereof rather, can really impact women and girls in a school setting. And this actually gets worse during a pandemic like COVID 19. Since, for example, in households wherein there is less income due to, say, loss of employment or financial difficulty, sometimes menstrual hygiene will take a backseat towards other needs like food or medicine. And therefore, women and girls may have more difficulty in purchasing sanitary products for themselves. Sometimes, in cases wherein a community is locked down for a long time, or if someone has to get quarantined or hospitalized, there is also difficulty in acquiring sanitary products. So sometimes they have to go to great lengths to be able to get them. And communities that already had limited resources for water and soap and hygiene before the pandemic are even more pressed during a pandemic to keep up. And where menstrual hygiene is not possible or is difficult, it is also likely that there are difficulties also in having enough hygienic standards to keep away disease and other infections. So it is fortunate that the DepEd has some initiatives for menstrual hygiene underneath the WINS or Wash in Schools program. So some of these approaches include giving more access to sanitary products in common spaces like school bathrooms. So there are ways wherein girls can acquire or purchase sanitary pads or whatever they need. Another big initiative is having enough designated garbage pails or bins that are covered for disposing sanitary pads and products. So this is not only very clean but also keeps the school bathroom looking and feeling fresh. And another big aspect is improving the facilities so that toilets, especially the women's or girls' toilets, are spacious and private so that they can be able to manage their menstrual hygiene in peace without being disturbed. Another innovation is to also have a space to rest and recover from menstrual pain. This can be in a school clinic or just near the bathroom so that a woman or girl who is having dysmenorrhea or pain during menstruation can simply go there to rest for a short time. A big aspect of menstrual hygiene in schools is giving enough information on how to dispose of used pads or clean up, as well as having advocacy for both boys and girls in the school setting. So this advocacy should cover reproductive health and hygiene as well as menstruation. A big part of it is also making sure that adolescents understand that menstruation is natural, it is not an illness, it's not something to be ashamed about, and it is something that requires support each time, each month, especially for those who have difficulties with their menstruation. So, a step forward is the hashtag Meron Ako campaign, which is spearheaded by DepEd and UNICEF. So, this is meant for adolescents in pilot schools in Northern Samar, and the target behavior was to increase awareness and remove stigma about menstruation. So, this is a very advocacy based strategy with making educational materials and infographics about menstruation, such as, really cute cartoons about girls being proud about their monthly flow. This will also involve engaging students and teachers with these materials and opening discussion about menstrual health. When the pandemic hit, this eventually evolved an online platform wherein the learning could still continue. So, initiatives like these are important in making sure that women and girls in all schools will be able to have access to proper menstrual hygiene and support during their periods. So, it is greatly to be wished that someday all DepEd schools will have something like this and be able to give the support needed to their female students and staff.